Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Expectation versus Reality, Youth-Led Webinar Series, Part 1, Media and Substance Use. But before we begin, we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question during any part of the webinar, please use the chat box that is located on the Zoom control panel. We will address all questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. To begin using our chat box, if you are viewing as a group only, please go to the chat window using the chat icon and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. This will help us with our final attendance count. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based health centers through technical assistance and training. We advocate for SBHCs on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. The School-Based Health Alliance Youth Advisory Council, as you're viewing on your screen, was launched in 2013 as part of our ongoing efforts to support the youth voice in school-based healthcare. YAC is comprised of high school and college students and focuses on leadership, advocacy, and service aimed at the promotion of school-based healthcare at a national level. When it comes to young people's health, especially their perception of body image and substance use, the effects of media can be powerful. Today is part 1 of a 2-part webinar series led by the Youth Advisory Council to hear youth perspectives on media influences, receive skill-building tools to identify negative impacts and create healthy patterns, and learn how adolescents and adults can work together to develop programming that improves student health. Thank you, everyone. I will now turn it over to our presenters, Gianna, Nate, and Cameron.
Hello, I'm Gianna. I've been on the council for 1 year now. I'm a student at Salem State University, and I study philosophy and English.
Hi, my name is Cameron Estrada. I've been at the council for a little over 3 years now, maybe 4. I'm an intern for the School-Based Health Alliance as well as a member of the Youth Advisory Council. I go to Texas Christian University. I'm a sophomore and I'm studying social work with a minor in women gender studies.
Hi everyone, I'm Nate Baptiste. This is my second, almost 3rd year on the council. I attend Louisiana Tech University.
Bear with us one moment. Nate's lost his audio and he is our first presenter, so give us a second while we bring him back in.
Can you hear me now? Okay, I'm so sorry about that. So, thank you so much. There are numerous platforms, whether it's print or digital, that impact young people today. People see themselves and their peers that have been both negative and positive influences. One of the oldest roles that media plays when it comes to our health is driving our perspectives when it comes to substance abuse and substance use. Before we dive deeper into these impacts, I'd like to ask you all a question. What have you or your health center heard from youth about substance use? Please use the chat box now to send in your answers. Okay, so we're getting responses now, such as marijuana isn't a drug or it isn't illegal. A lot of our youth want to hear the facts. And recently, kids had to get high for 20. And so I'm seeing that everybody wants to hear facts. And so thank you so much for your responses. This brings us into a couple statistics about substance use and social media. Um, Social media is a major platform or gateway for young people. Out of all the media, social media is the biggest. And so as you can see here, 92% of 13 to 17-year-olds of teens go online every day. And so as they connect, social media is the biggest platform because they connect everything together. Social media can be used either good or bad. And it can drive young people to make decisions, whether it's from seeing people or just hearing about it, from peer to peer, from unknown sources, as well as ads, where anybody can buy in to promote substances while they are targeted towards young people, and seeing how they utilize social media and how they use them. And so, 40% of teens surveyed stated that they have pictures of other teens. They have seen pictures of other teens who have abused various substances such as marijuana, alcohol, pills. And so seeing photos online of other youth or young people their own age in their minds creates a world of acceptability. In many different platforms of life, it is seen as a normal piece of life. As you can see from the examples, these are just a couple movies that promote it as being acceptable and not having any realistic consequences. But there are many platforms that show the reality, such as the Truth Campaign, which is trying to show the reality of substance use as they are using young people to deliver the message that just substance use does have consequences and it does affect your life. And so different platforms have different perspectives. While in movies it may be alcohol, in music it may be popping pills or Molly. When it comes to different platforms, we have to counteract what the media says by having real input from real people, in which Gianna will explain to you guys.
So it's important to note that art and expression are very positive outlets, and it's important to encourage them, but simultaneously, there is a time where expression can become toxic when we are glorifying these things. And so on the screen, I have just two examples of songs from the rap genre that show an example of someone talking about the experiences that they have faced, and the other glorifying drug use. So there's a clear difference between the two. And one of the most important facts that we want to bring to the forefront of expectations versus reality is that this is not the reality. Most people are not partaking. In the study shown to the right on the screen, it shows that less than 21% of teens and young people are partaking in alcohol use. And though those numbers we wish would be lower, of course, we are happy to see that the majority are not, and that it is important to share that with the youth, that most people aren't doing it, so you should not feel pressured to partake.
So what can we do about it? And thank you, Gianna, for that great lead up. YPAR, or Youth Participatory Action Research, is kind of a step-by-step guide on how to involve youth in this problem and how to get them educated but also engaged in this type of research and this type of work. So YPAR, a step-by-step of it, is first working with a group of youth to identify a problem or issue. In this instance, we used drugs and alcohol being portrayed in the media. From there, once you have identified the issue or problem, you find information and sources that could best help you guide your practice. Once that has been set by you and your youth, you work together to determine what methods to find information about your specific community would be best used. So for your set of questions and for the information you want to find out, what works best for your center and your school? Is that a survey? Is that or creating a website where you can ask people, or where people can comment in questions? Or how is it best for you guys to obtain that information about your school? Once you've collected your information and have done your research, it's important to use that information for different, for some sort of action, whether that's an initiative, a program, a campaign. And so it uses you through every single step of this. Why is it important to use youth in this type of work? Why do we need to involve youth in programs? Well, youth are the primary stakeholders. They enhance the quality of which the operations work. So whether or not it's a campaign, an initiative, tabling at lunch, if you have youth involved from the beginning to the end, those youth are going to be able to counsel and guide in the way that's going to be most effective for your students and for your clients. In addition to that, it also empowers them to take control of their own health and of their own lives. So moving on, for us, how did we use YPAR in this situation is, well, together as a group, we developed a survey asking different questions that would be appropriate for students of high school age. And then I personally contacted my old health teacher and my old health center. And together we worked together to survey about roughly 85 students, ranging from freshmen to sophomores, getting together as much concrete data as we can. And then from there, I did about 20 video conference interviews. There, I was asking questions similar that were on the survey. But how would you guys use YPAR? How would a center use YPAR? Well, for us, we use it to inform this presentation. For an actual center, YPAR would be used as to inform an action piece, an actual tangible campaign, an actual creating a video to show your kids, creating a tabling session, whatever that looks like, using this information to best serve your center. Now, sorry about my allergies. What did we find? For us, like I said, it came from my old high school. I'm from Roswell High School, and this is a quote from a junior named Paige, and I felt like it really encapsulated what we were trying to find here. And we've solved similar answers from other people, but this idea that these artists and actors are their idols, and to them they want to emulate them in what they're doing. So looking at the numbers, we can see two very extremes. On the one hand, we have cannabis, where most students did believe it was harmful, but very right there at that halfway point. And as most of us know, actually all of us know, there's been a lot of legislation and policy push to decriminalize cannabis, which has really changed the mindset around it. In addition, it's very much glorified in the media. There's songs, movies, music that Nate has all talked about, where it's been really popularized. Now, on the other end of the spectrum, there's the positive. As we look at cigarettes, there's been a ton of policy changes. There's been huge movements to counteract the positive image surrounding cigarettes. So we can see how media can do, how the bad side of it, and how it can lower people's adversity to it, such as cannabis. But then there's the positive, where like cigarettes, where there's been multiple campaigns that make cigarettes seem very harmful to youth. Moving on, see, is I have a question for everyone, and again, use your chat box, don't be afraid. Has your center ever involved youth in the development of a campaign? If yes, was it beneficial? What the process looked like? If no, how can you see yourself involving youth in the future? So, let's see. Let's see what answers we're getting in here. I know this is a long question, so take your time. Okay. Let's see if we can get any little answers here. Okay, developing lunchtime chats, that's a great idea. I can definitely see how youth can be involved in that, on how to have those chats, how do you conversate with youth about the subject. Great idea. There's anyone else who wants to comment at the end? This conversation will probably come up again. But moving on, a great way to involve youth from beginning to end is SBIRT. SBIRT is a youth-focused intervention. It's been evidence-based, and there has been a lot of research surrounding it on its effectiveness. Now, SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. Now, this process is meant to help students with to prevent substance use, to identify, and to reduce it. So, for example, screening. You can ask youth, what's going to be the best way to ask these questions? Is it going to be face-to-face? Is it going to be a written paper where they can check yes or no? Asking your youth what's going to get the most honest answers is going to be really helpful. For brief intervention, this is all based on motivational interviewing, which is, again, very research-backed and has been shown to be really helpful. In this process, your staff and the people working within these motivational interviews can practice with your youth to make sure that they're the most effective and the most youth-friendly. And referral to treatment intervention, this is for students who you identified do indeed need treatment for substance use and need to find that treatment elsewhere than inside your clinic. It doesn't usually make common sense on how to use youth in this situation, but this can be a perfect place. Your youth can be able to go out in your community and find out which places are youth-friendly considering treatment, whether this is places that are youth-focused, places that are nearby, places that are walking distance, places that are low to no cost. You can really involve youth at every step of the way within this process. And like I said, this is a evidence-based, research-backed program, but there's also so many more. And Gianna is going to delve a little bit more into those, so off to her.
So before I begin, I have a question to share with everybody, which is, have you had experience untangling the influence of media personally or helping someone else, and what has worked in your situation? So write that in the sidebar if you have any answers. Okay, so one comment has said that they find it very hard. We don't always know how the media affects us, even if we are singing a song, which is absolutely true. It can be a very insidious thing. All right, any more suggestions, answers? Okay, well, I have a couple slides that I think could give you some answers. So here's some examples of how health centers can help change the narrative. So it is important to educate adolescents and youth, as they are the most impressionable group to be negatively influenced. A few ways to share this information could be hosting your own informational session through your health center. A great way to do it would also be to team up with a school's health or psychology class and help incorporate this information into their curriculum and arm students with the knowledge to be aware of these influences. Another way that we could do it is to rewrite the rules. So empower your students to change what they're hearing. So if they hear a song that they particularly like or that resonates with them, but it may be glorifying some, unhealthy behaviors, encourage them to rewrite that song, encourage them to get the same message across without that level of glorification, and it allows them to be creative and, get that same message out there without the negativity. And the last suggestion I have, this is more of a personal note for me. I had a counselor who had encouraged me to change the music I was listening to because it was influencing my mood and my choices and distorting the reality of what was normal and what was not. I personally have always struggled with my mental health, and I had no idea that the things that I was absorbing around me were perpetuating the negativity that I had going on. So she would share with me music that positively influenced things that I could relate to. And if you may not have that knowledge handy of songs that someone may like or, something that you could share with them, encourage them to create playlists and do some exploring of their own of positive music. Post the playlist in the health center so other students can see it and challenge them to create one of their own. So put the narrative back in the students' hands. So that concludes our informational session. If anyone has any questions, we'll be taking questions on the side.
And just before we do get into that, we do have a comment in the chat box relating back to Gianna's question that having a discussion with youth about some of the popular artists, rappers, and celebrities they know and talking to them about how these artists passed away. Most have passed away because of substance abuse. That is a very great point.
Absolutely.
Okay, thank you so much. We want to continue to give others an opportunity to enter their questions. And while they're entering their questions within the chat box, we do have a few announcements for our attendees. We ask that you join us and become a member. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable programs, tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit our website with the address that's on the screen for more information and to join. Also, we have this year our 2018 National Convention in Indianapolis, Indiana. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. The School-Based Health Alliance is providing a limited number of scholarships for its 2018 convention in Indiana to students pursuing graduate education at master's or doctorate levels in nursing, social work, public health, and public policy. The deadline for this is May 25th, 2018. Also, one of the Alliance's upcoming learning collaboratives is motivational interviewing that will kick off as a free pre-conference to all health center programs on Sunday, June 24th. This is the first day of our convention. This interactive workshop equips you to use motivational interviewing to improve your ability to identify risk behaviors in social determinants of health, communicate effectively with teams, and motivate them towards healthy decisions. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. It is also the great opportunity for young people at our Be the Change Youth Training Program. Each year, students from across the country come to network with each other and school-based healthcare advocates and participate in various workshops pertaining to health, education, policy, and leadership. For more information is available on our website and scholarships are available. Deadline to apply for this year's scholarship is May 11th for our youth training program. I will now open it up for questions. So So again, please use your chat icon and chat into the box any questions that you have for our presenters today.
So I see one of the questions is, can you become a member if you live in NYC? I know for the Youth Advisory Council, that's definitely true. One of our members is actually from New York. I also, if you want to become a member of the Alliance, you can also be from New York.
And also, a question came in, if I wanted to be part of YPAR project, where can I look for resources or details to do this?
Yes, there is a link in the chat box that it's yparhub.berkeley.edu. Berkeley's the one who developed this program, so they have all the perfect, everything you need to know.
For the question that says, is there a fee to be a member? Not for the council. I don't know about the Alliance.
I think there is for the Alliance.
For membership, yes, for the Alliance, and they can go onto our website under membership, and it will definitely provide you more information about our membership. You can also send us an email at info@sbhforall.org, and it will also be able to contact us that way.
Let's see. Can you share some examples of popular health campaigns on social media that are popular with young people today? So I know one health campaign that did really well on social media was this is more of a behavioral health, so more of holistic health. The Me Too campaign was super huge with youth. Again, that's helping survivors due to sexual violence. So that was really big. As for health, I know that we as a youth, we have a Twitter, we have an Instagram, and we once a year do a Twitter chat, which is when we pair up with the Alliance, and that's always super great, and usually it's trending really well. So that's always a fun time. Always want to check out our Twitter and our Instagram for more great things. Just putting our plug in there.
I have also seen recently an FDA campaign against smoking that featured many popular drag queens. So I know that that's a little more LGBTQA plus focused, but their drag queens are becoming more in mainstream culture today. And so seeing that commercial with a lot of beautiful people showing off that they are not smokers, that was definitely something that I'm seeing gaining a lot of traction right now.
Thank you. This is great information. And let you all know this is being recorded, and the slides and the recording of this webinar will be uploaded on our website in 3 to 5 business days. We will send you a follow-up email with the link included. Any other questions or anything, Cameron, Gianna, or Nate, you would like to add?
Thank you very much for tuning in.
Yeah, thank you much for listening to us. Look on our website. We have super great resources there involving so many different things about the youth track and what the Youth Alliance does as a council. If you have any youth who are interested, we've had super great experiences, and we'd love to hear from y'all.
Yes, so please do not be shy. We always love getting your emails, your comments, your tweets, and even your text messages. So please reach out to us.
All right, perfect. Thank you so much. And we will definitely send a link with our survey evaluation questions. We really appreciate if you take the opportunity. So thank you to Cameron, Nate, and Gianna. And to our attendees, we hope you can be part of our mission by becoming an Alliance member. Sign up for our June 2018 convention, and we look forward to you joining us on this Thursday, April 26th, for part 2, Media and Body Image. Our council will also be presenting then, and we thank everyone so much for attending our webinar, and have a wonderful day.